Alrighty. Thank you for people that are joining. Thank you for anybody that catches this as a replay. My name is Brian. I'm an ICU nurse. I've been working on a ICU that takes all of our ICU COVID patients for the past year and a half at this point, over a year and a half, really. Um, so I just kind of want to give a couple minutes for a couple more people to join in if they want to. Um, I am, sorry, checking messages on my phone as well. Um, I am kind of at the point now where, and I think a lot of healthcare providers are, we're kind of burned out. We are really tired of COVID. We're tired of dealing with it. We're tired of uh, all of the PPE that we have to go through in any one given shift. We're tired of watching unvaccinated people come in and die. We are just literally burnt out. I feel it, and I know that a lot of the nurses that I work with feel it as well on both day shift, night shift. I work night shift probably myself, but I have quite a few friends that work day shift, and they have the same feelings. They really do. It is not the easiest thing to deal with. Um, and a lot of this could have been mitigated had this been taken seriously from the very beginning. Um, I blame a lot of this on Trump's mishandling of COVID when it first hit our shores. Um, the people that were coming back in from affected areas in China should have been quarantined until they were deemed to either be non-infected or they had gotten over the illness if they had contracted it. But that wasn't the case. The people that came back from infected areas of China were just sent on their merry way to go back into the general population. And that's where this started. And now we have multiple variants, Delta variant being the most common of the variants that we are seeing right now in the United States. And there are other variants out there as well. The Lambda variant being another one that the CDC is watching specifically. But all that being put aside, um, if this had been treated the way it should have been treated, had we had a um, pandemic response team at the time that this pandemic had started, I think a lot of this would have been a lot different. I think we would have a lot fewer deaths here in the United States. I think that had people taken this more seriously uh, and not hopped on the Fox News bandwagon of, oh, COVID is a joke, oh, COVID is just the flu, or COVID is just a cold. It's not. It really isn't. I can tell you from firsthand experience. I can tell you from literally watching a patient die on one of my last shifts that this is not a cold. This is not just the flu. And yes, people die of the flu, but people are dying of COVID at a much more alarming rate than they died of the flu. Um, and then there was the whole argument of, well, natural immunity. the last time that a major pandemic hit, back when the Spanish flu was around in 1918 to 1920, because it lasted about 2 years. A lot of people don't realize that. They think that they hear the words Spanish flu of 18 or 1918, they think, oh, it lasted for a year, or one season, or one flu season. It stuck around for 2 years, killing people. And it took about 50 million deaths worldwide for the world to reach natural immunity to the Spanish flu. And the Spanish flu didn't affect your normal people either. It didn't affect your elderly. It didn't affect your young. It affected your middle-aged people. It affected your people as young as 20 years old, all the way up into their 40s, 50s. So that's the people that it killed, and that's the people that we're seeing that are dying of COVID with this wave. We're seeing those people coming in with severe cases of COVID now with the Delta variant in their 20s to 50s. Hey, Jason, thanks for joining. I appreciate it. So that's where we're at now. We are seeing a surge in specifically unvaccinated people. Um, I can literally count on one hand probably how many vaccinated cases we've had in the ICU. Now, it's not to say that there are not breakthrough cases, because there are, because I've seen them myself. But they are a vast majority, or sorry, a vast minority of the cases that we are seeing. The majority of the cases that we are seeing are unvaccinated people coming in, people that either thought that they didn't need the vaccine, or they didn't want to get it for whatever reason, because Fox News told them not to, or because they felt that they didn't need to get a vaccine because they were healthy enough. Well, this Delta variant is infecting those that are healthy, and it's killing them. I've watched people as young as myself in their early 40s succumb to this disease, and it's not easy. It's not an easy thing to watch. I don't know when it will be diminishing in Los Angeles. Unfortunately, Jason, I will say that as the numbers are showing right now, we've kind of hit a plateau. We're not seeing a huge spike in cases, but we've also seen that in previous waves where it will plateau for a short bit before it starts going up again. I'm hoping that's not the case, though. I'm hoping that maybe the surge will be a little different. Maybe the surge will be a little bit less. Um, but honestly, I think that might be wishful thinking, just because of the mentality of so many people out there, the mentality of so many people that are anti-mask and anti-vaxxing, and people that are fighting against school boards that want to mandate masks for children to protect the children and protect teachers. Um, my wife is actually a teacher. That's what she does for a living. She is currently not working at the moment, but she is looking into getting just starting in as a substitute in the county that we live in. And the recruiter, or the person that's in charge of the substitutes that's onboarding her, told her that they have had, um, I won't give the exact number because I don't want to give my exact location away, but they've had I'll just say over a dozen teachers have died of COVID already in the school year. And we've only been back in school for about 5 weeks here um, in my area. So um, that goes to show you something. Um, Teachers are dying of this. Healthcare professionals are dying of this. There are those, even healthcare professionals out there, nurses, um, therapists, respiratory therapists, whoever, um, that for whatever reason don't want to get vaccinated. But they're a minority. I can tell you specifically the people that I work with. I want to say that almost all of them are vaccinated. I can't think of one person that I work with, honestly, that I work directly with, I will say, that I know for certain is not vaccinated. They've all taken this seriously because we've all seen the toll this is taken on people. We've all seen the heartache and the loss and the death, and it's not just the death of somebody. It's not just the fact that, oh, well, this person died of a disease. No, it's that affects an entire family. That affects spouses, grandchildren, grandparents, parents, siblings, cousins, friends, family. I mean, just on down the line. It's not just that a person dies, it's the people that they have left behind that is affected, the people that are left to pick up the pieces after this has happened. Um, it's not. Um, it's not just deleting one person from existence. There's a lot more to it than that. Uh, I don't know, Jason. I don't know if there's going to be specifically lockdowns in California again. Um, I kind of wish that there would be in many states, especially the states that are seeing very high transmission rates. California's rate has not been horrible to the point where I think they need to do lockdowns, but I do think that uh, mask mandates statewide would be a good idea. Uh, I wish that we would do that here, honestly. But in Florida with Ron DeSantis or Ron Death Santis or Death Sentence, however you want to hashtag him in Twitter, um, I don't see it happening. I really don't. I see that he's going to try and ride this out. And I did see an article in the Miami Herald. I did not get a chance to read the entire article. I skimmed through it real quickly. But just before this last surge, somehow the state of Florida started manipulating the death numbers of COVID patients. And I'd like to go back and find that article. I think I saved it actually, but I need to go back and read that, just because things like that are sickening to me. That the government, that people like Ron DeSantis want to falsify information to make things look better than they really are. Um, I mean, honestly, I would err on the side of caution because if somebody dies of COVID, they die of COVID. If they die of complications because of COVID, they've died of COVID. COVID has caused those complications. Um, it is not an easy thing to go through. Um, and I will tell you that I've had patients deny up until their almost to their dying breath that they're that COVID is a hoax, that what they have is not COVID, that COVID doesn't exist, or that uh, they refuse the treatment options that we give them because they don't believe in COVID. And even families, even after the patient is incapacitated and on a ventilator and fighting for their lives, and we're giving them every medication that we can to keep their body alive. Um, we tell the family, hey, this is what needs to be done. We need to give them this medication that's for COVID, and they refuse it. Refuse to give their family member this medication because they too don't believe in COVID. And it's sad to me. It really is because I've seen this happen. I've watched it happen. I watched a patient die because they refused to believe. They refused to acknowledge their diagnosis. They refused to accept um, the treatment options that were available to them. I can't necessarily say that this patient even would have survived, even given the treatment options, because even given the treatment options that we have available at this time, um, it's still not the best of options, even for people that, especially for people that are not vaccinated. People that are vaccinated are not coming down with as severe cases of COVID. People that are not vaccinated are, or people that are vaccinated are typically recovering at home with minimal intervention. They're not coming to the hospital short of breath with oxygen saturations in the 70s and 60s. Um, Oxygen saturation for a normal healthy adult should be 98 to 100% at any given time. It should be 100% most of the time. Somebody that has a history of smoking and may have emphysema or chronic COPD, they might have an oxygen level that ranges between 88 and 92%, which is still okay given their condition. Uh, but I've seen people walking into ERs with oxygen levels in the 50%, 40%, um, and they try everything that they can, and we run all of the tests that we can down in the ER, and it's determined that this patient, the only thing that's going to possibly save their life is to be intubated and put in the ICU. And our ICU has been beyond capacity for weeks and weeks now. The ICU I work in is only typically a 12-bed unit. It's a 24-bed unit in total, but the other 12 beds are typically reserved for step-down patients. But we've had to expand our ICU into that step-down unit, um, unfortunately, without adequate staff to be able to man that. Nurses are taking care of 3 and 4 patients at a time that are ICU level. Um, and that's just not a sustainable thing. You can't expect positive outcomes when nurses are stressed beyond or stretched beyond capability, because the capability of taking care of ICU patients is typically 2 patients for every 1 nurse. You start throwing 3 and 4 patients at a nurse, and it's hard. It's not sustainable. It's not achievable. It's not something that they can just easily do. So that's kind of my spiel on that. I will say that some of the best options still are social distancing, wearing masks, washing your hands, sanitizing your hands, um, not going to public places where there are large gatherings, not going to concerts or conventions or things like that, where multitudes of people are gathered in tight quarters. Because there are a lot of places, even here in the general area where I live, they're still doing conventions and things like that in closed spaces. Um, I think that those types of things are kind of ridiculous to be going on right now. Yeah, they just started concerts in quite a few areas, which I think is ridiculous. You think about a concert, packed with so many people. Yeah, people elbow to elbow, and they're not wearing masks. That's the thing. If people are going to concerts, they're not worried about wearing a mask. They're worried about seeing the performer or whoever it is that's the artist or the band or whoever they're there to see. That's what they're there for. They're not concerned about keeping a mask on, socially distancing. I see that as a recipe for disaster, honestly. I see that as a just one person walking around that crowd, how many people they could possibly infect. Uh, it's mind-boggling to me. And in many places, especially like Florida, we are stretched beyond capacity in hospital beds, ICU beds, and nurses are getting burnt out. Nurses are literally leaving the profession because the stress is too much, the heartache is too much, the demand is too much. Um, Nurses are taking leaves. Nurses are out with COVID. I can attest to that right now as well. We have several nurses that I work with that are out with COVID. Most of them have been vaccinated. They have mild cases. None of them have required hospitalization, luckily. But the fact that they're out with COVID puts more strain on the rest of us that are there because the shifts that they can't cover because they're not allowed to come back to work um, aren't being covered just because we don't have the staff or the capability to man those beds, to man all of these people that are coming in. And back to what I was saying earlier about us, our kind of taking over our step down unit. There have been nights where um, we've had 18 or 19 ICU patients versus having a maximum of 12. Uh, and at nighttime, we try and keep what we call a crash bed available. Um, so we keep one bed empty at all given times so that if something happens to somebody else in the hospital, there is an ICU bed for them to go to. If they deteriorate or they need um, a higher level of care than where they're at, that availability is there. But recently, that's not been the case. Recently, we've had um, ICU nurses that have had to go out and manage a patient out on a regular med surge floor because there just was not a physical bed available for them in the ICU, which then in and of itself creates a dilemma, creates a problem. Because when that nurse is away and they're 2 floors above you, they don't have the resources of other ICU nurses around them to help when they need it. Uh, Whereas the nurses that are around them on like a medical surgical unit or something like that, or even a telemetry unit, they don't have the training that an ICU nurse has. They don't have the skill set. They don't have um, the same level of, I don't want to say cognition, but the same level of experience that an ICU nurse has. Um, so a lot of times they're not able to help out efficiently when that ICU nurse does have an issue. Um, if they're having to take a remote assignment like that, um, and that can be detrimental to the patient itself. Um, and like I was saying about keeping that one bed typically open for a crash patient, um, that could be anything. That could be somebody that comes in um, with stroke-like symptoms. Maybe they're not even COVID, and they get put on a neuro unit, and then all of a sudden their condition deteriorates, and they have to go for another CT, and they find out their stroke has evolved, and they're requiring a higher level of care. Those patients need to have a place to go. Those patients need to be able to be placed into an ICU unit where the monitoring is much more stringent and the nurses are much more trained to deal with more acute situations like that. And I know this is happening not just at my hospital. This is happening at hospitals all across the state, all across the country, honestly, where the surges where the record numbers of surges have inundated hospitals with COVID patients. Um, it's just crazy to me. It really is. So I do wish that things were different. I really do. I don't know if anybody has any specific questions they would like to ask. Um, I don't really have much more that I really wanted to talk about tonight. I didn't really come up with, I didn't look up numbers or come up with an agenda or anything I specifically wanted to talk about. I just kind of wanted to come on and just talk about the situation in general. Talk about, uh, like I said, some of the needs that are required in the hospital. The fact that we are short-staffed, that we are seeing nurses that are out with COVID, that we are uh, running at overcapacity. My particular hospital, we've been on many, many, many shifts that I've worked. Actually, I would say probably every shift I've worked in the last month, we've been on what they call critical care bypass, where any critical patients that like fire rescue or emergency services were to pick up, they can't bring them to our hospital because we don't have the capacity to take care of those patients. And then many, many nights out of that last month and a half, I would say, we've been on volume bypass as well, which is a separate type of bypass where EMS and emergency services can't bring even a non-critical patient to us because there are physically no beds left in the hospital. The only people that are actually coming into the hospital are typically the people that are driving themselves there. And they can't be turned away at the ED. But the problem is that they're just going to sit in the ED for hours and hours and hours and hours until the bed opens up, until one of two things happens, until somebody is discharged or somebody dies. Um, and that's the cold hard truth and reality of it. These people that are coming in that are expecting to be able to get a certain level of care, to be able to be placed in a hospital bed, are just sitting in an ED on a stretcher for an hour or a day, or sorry, for hours or even a day or longer before a bed does become available. So I really don't, like I said, I don't have much more than that. I will say that I appreciate everybody for coming in. I appreciate any replay viewers that might catch this later. I know I broadcast a little bit later than I normally do, uh, but there are reasons for that tonight. I do work the next several nights, so I probably will not be broadcasting, but I am trying to get back to where I am broadcasting more often while I'm off. So I do appreciate everybody coming in. I hope that y'all are staying safe. I hope that y'all are wearing masks. Get vaccinated if you're not. Wash your hands, socially distance. Um, Urge others to do the same thing as well. Uh, I can't stress enough how well masks actually do work when everybody's wearing them. That's the key. Everybody has to be wearing them. So I hope you all have a good evening. I'm probably going to go ahead and sign out of here. Um, Take care, be safe, and have a good night.